Today we're going to talk about a topic that is challenging for many women who are newly diagnosed with breast cancer, and that is the decision about what type of surgery to have. And many women have their doctor say to them, you can have either a lumpectomy or a mastectomy, and the option is up to you. And that can seem overwhelming, especially since before the diagnosis you probably knew nothing about breast cancer. So what I'd like to do is I'd like to break it down into what are the differences between these procedures and what are some of the things that you should think about as you make the right decision for your body. One of the things that I like to do with my patients when I talk about the options of mastectomy versus lumpectomy is to do a brief history of breast cancer to understand what have we done in the past and what do we do today in 2018 and why do we do the things that we do. So if you were diagnosed with breast cancer in the early 1970s or before, or maybe you have a relative who was diagnosed then, really they had one option from a surgical standpoint, and that was a mastectomy. Every woman, no matter how big or how small their tumor was, a mastectomy was the treatment that was offered to them. And mastectomy was good at controlling the cancer, so the risk of recurrence after a mastectomy was about 5%. So really good at controlling the cancer, but not great from a body image standpoint, and probably more treatment than most women needed. So in 1976, they decided to try what we now call a lumpectomy. And that procedure is where you take the tumor in a normal rim of tissue, usually about 1 centimeter, and remove that from the breast, but you leave the breast intact. So the idea is to have a breast that looks like the other breast, but maybe just with a little bit of volume loss from where the tumor was taken. And what they found was that if they did a lumpectomy alone and they got clear margins, meaning there was no tumor extending up to the edge of what they took out, the risk of recurrence was about 40%. So 40% is not good enough. 40% compared to 10% or 5% is not good enough. So what they said was, well, if we know that 40% of the time the cancer's coming back, what can we do to sterilize those cells that may be left behind in the breast that are causing that recurrence? And that's when they started using whole breast radiation to sterilize the cells that are left behind after lumpectomy. And what they found was if they did the lumpectomy and they followed it with radiation, the risk of recurrence in the breast, so the cancer coming back in the breast, went from 40% down to 10%. And so some people say, well, that's not good enough because it's not 5%, it was 5% with a mastectomy. But the good news was that in that 10% of women that it came back, they could have the mastectomy at the time of recurrence, and they lived just as long as if they had the mastectomy up front. So that tells you the survival is the same. Women do not live longer from having a mastectomy over a lumpectomy. And 90% of the women who had a lumpectomy were not going to have the cancer come back and never need a mastectomy in the future. Only 10% would. And it turns out that actually we're better than that now. That data is really old. It's probably about 20 years old, the 5% and 10% risk of recurrence with mastectomy versus lumpectomy. And we've gotten better with our techniques. We've gotten better with our systemic therapies. And the risk of recurrence in the breast or on the chest wall is probably in the order of 1 to 3% with either a mastectomy or a lumpectomy. And so the risk of recurrence is quite low with either, and women are not going to live longer from having a mastectomy. So when you think about it that way, you don't need a mastectomy to live longer. You are going to live, your lifespan should be the same with a lumpectomy plus radiation or a mastectomy. But if you choose to have lumpectomy, you most likely will need radiation as part of your treatment. I say most likely because there's some caveats in older women where we're using less radiation, but I would say in general, if you have a lumpectomy, you need the radiation as part of your treatment, okay? So that's helpful just in terms of thinking about what is the risk of recurrence with the two. One other thing that I always like to point out is that the risk of recurrence is never zero when you have a mastectomy. A lot of women come into my office and they say, just take my breast off. I never want to deal with this again. And the truth is that most likely you will never deal with this again, but it is never zero. So by removing your breast, you never reduce your risk of cancer recurring to zero. There's always some risk that the cancer come back. So having a mastectomy to eliminate that risk actually doesn't make sense, just because there's always the chance that the cancer can come back. And it is very low with either a mastectomy or a lumpectomy. Now, the next thing that I'd like to talk about is kind of the logistics of the different procedures and what are the difference, recovery, hospital time, and all of that with a mastectomy versus a lumpectomy. Now, we've already gone through that the recurrence is very low with either a mastectomy or a lumpectomy. The survival is the same. The hospital stay for the procedures can be different. So with a mastectomy, I'd say most women have an overnight stay with a mastectomy, although not all hospital systems do that. Some have you go home the same day, but I would say most places you stay overnight. With a lumpectomy, you go home the same day. So it's an in and out procedure done as an outpatient, and you'll be sleeping in your bed that night. The recovery time from a mastectomy and a lumpectomy is quite different. So a mastectomy requires about 4 to 6 weeks of recovery time before you're ready to go back to work. With a lumpectomy, most women are back to work in 3 to 5 days. The question of whether or not you need to have your lymph nodes sampled is unrelated to the type of surgery that you have. So you'll need your lymph nodes sampled if you have an invasive cancer, and you will need that if you have a mastectomy or a lumpectomy. And if the lymph nodes are positive, it doesn't affect what type of procedure you need on your breast. So you can have a mastectomy or a lumpectomy if the lymph nodes are involved with cancer. It just changes how we manage the lymph nodes with both surgery and radiation. The other thing is what's removed with a mastectomy versus a lumpectomy. With a mastectomy, the entire breast is removed. We do leave the pectoralis muscle, which is something that actually back in the 70s when they did mastectomy, we took that. But the whole breast is removed, including the nipple and areola most of the time. With a lumpectomy, the nipple and the areola is left in place most of the time. And so you have normal sensation of the nipple areola after a lumpectomy. And with a mastectomy, even if they leave the nipple, most of the time you do not have sensation. So it does not get aroused with sexual activity or foreplay. The other thing that we didn't talk about is drains. So with a mastectomy, you need drains that are tubes that are sewn into the chest wall under the skin and left in place usually for 5 to 7 days. And it's put in place to drain blood or bodily fluid that accumulates in the resection cavity. And with a lumpectomy, you do not need drains. So drains are something that you only have with a mastectomy, you would not have with a lumpectomy. Another thing is chemotherapy. So people ask, well, if I get mastectomy, do I need chemotherapy? Or if I'm having a lumpectomy radiation, do I need chemotherapy? And the chemotherapy is unrelated to the type of surgery that you have. The question of whether or not you need chemotherapy is going to depend on whether your lymph nodes are involved with cancer, and then also some testing that is usually done. If the lymph nodes are negative, oftentimes we'll run a test called the Oncotype DX that helps us make some additional information or decisions about chemotherapy. So that question is unrelated to the type of surgery you have on your breast. And then the last thing is need for another operation. So you can imagine if we go in and we take out the tumor and there are tumor cells extending up to the edge of what we take out, we're going to need to take you back to the operating room to do another surgery. In the option of a mastectomy, the risk of positive margins is very low, meaning that you don't need a reoperation most of the time in a mastectomy. The risk of reoperation is like 1 to 2% after a mastectomy. With a lumpectomy, historically, the chance of needing another operation has been about 30%, but more recent data with some new guidelines that are out suggests the need for another operation is about 15% with a lumpectomy. So you would have a higher chance of needing to go back to the operating room and have another procedure if you have a lumpectomy versus a mastectomy. And then the last thing to think about is how these different procedures change your body shape. So a mastectomy even if you have reconstruction, the shape of that breast or the chest wall is going to be quite different than the breast on the other side. And so clothing is going to fit differently. And there are ways for us to overcome this. There are bras, there are prostheses that you can put in your bra to help give you the shape, but it is something that you will have to think about in terms of how you dress your body, and then also how your body looks unclothed. So with yourself and with your partner, those are things to think about. What's important and what matters to you in terms of what scars and what shape your body is in after you've completed all of your treatments. Because the good news is that with breast cancer, women are living such a long time after their diagnosis, and many women never have the cancer come back. But you're always going to live with the changes that happen to your body related to the type of surgery that you have and treatments that you have for your breast cancer. So I think it's always important to really think about that in how you would feel and how you will be in terms of living with those changes.